All right, we are live on Facebook. So I am Megan Phillips, and I am joined with Jody Ambrose. We are the co-founders of the nonprofit Train with Trust project. We're dedicated to making equine behavior education accessible to everyone and promoting the use of evidence-based training practices. Of course, we have Dr. Sue Dyson here with us, world-renowned equine orthopedist, known for her clinical work as well as her extensive research, including her research, which was used in developing the ridden horse pain ethogram. Dr. Sue is busy lecturing internationally to a wide range of audience, so we're very thankful that you're able to join us today and answer everyone's questions. As we're getting started, today's topic is really near and dear to us here at the Train with Trust project because as behavior educators, job number one for us is helping people to recognize and understand the difference between behaviors, observable, measurable behavior, and mental constructs or labels that we assign to behaviors in an attempt to explain the reason or motivation behind a behavior. So again, we're very excited to have Dr. Dyson here to help us examine this idea as well as answer questions about some very common labels that we place on female horses, such as marish or moody, along with the several other labels. And these labels that come along with a host of assumptions about the underlying causes of behaviors that we see in mares. So Jody's going to go ahead and kick off the conversation with some questions that have been submitted ahead of time. And I will be in the background collecting those questions so that Dr. Sue can answer them. It's likely that we won't have time for all of your questions here today, but we will follow up in the comments, or we will follow up in the Ask Dr. Dyson blog that'll be available that is on our 24horsebehaviors.org website. So that being said, I'm going to go ahead and go behind the scenes and let Jody and Dr. Sue carry on.
Hi, I'm Jody, and as Megan said, this, sorry, my dog decided to join the Zoom call as he's wont to do. This topic is very important to me because I work in the area of behavior, but also because I have been a dressage trainer for about 30 years. And when it comes to mares, I'm a convert. I was the person that when I went to shop for a mare, when I went to shop for a horse, didn't include mares. I discouraged students from buying mares. Really there were a few exceptions, but for the most part, I made a lot of assumptions about mares. And through my career, I changed. The more I learned about behavior, the more I wasn't concerned with marish behavior because I did feel like it was observable, measurable, changeable, and that some geldings had the same issues. So it wasn't really fair to just attribute them to mares. But I will admit that I did still hesitate when looking at mares as a prospect because of how often it seemed like they had physical pain issues. And so I'm really excited to speak with you, Dr. Dyson, about lameness diagnosis specific to mares, and if there are certain things that we can understand better to make it more egalitarian and not judge mares for their gender, but for their individuality. So the first question I'd like to ask you is, are there, of the 24 behaviors, or perhaps any of the other behaviors that you studied, are there some that you would see more often in mares than in geldings or stallions? And if so, what were they?
The simple answer is no. I think that a lot of behaviors have been attributed to mares, such as aggressiveness or being difficult or being sensitive around the flanks or putting their ears back or switching their tails. And these have no relationship with the estrous cycle of the mare and are much more likely to be a general reflection of something else going on within that horse, rather than a reflection of the fact that the horse is a mare. We've seen in all work disciplines that mares can be very, very successful and consistent competitors, assuming that they are pain-free and well-produced. So I think it's really a myth that mares are more sensitive and more likely to be inconsistent performers than either geldings or stallions. I think it's just not true. And when you think about mares and you think about the mare in estrus, that's when she's in season, what is she going to do? She wants to show that she is happy to accept the stallion. So she is actually very compliant. She puts her ears forward. She'll lean towards other horses, particularly male horses. She may show clitoral winking. She may squat to urinate, but she's generally a compliant, tolerant individual, which is completely contrary to swishing the tail, putting the ears back, being aggressive. So it is ill-conceived to think that these behaviors such as aggression or unwillingness or resistance are attributable to the fact that the animal is a mare. And we also have to think that the mare, when she's cycling during the summer months, has a 3-week cycle, and she's only going to be in season for 3 days. So if one was to attribute behaviors to being in season, we would have to see a pattern in those behaviors only being seen when the horse is in season. And from a riding perspective, when the horse is in season, she actually may be less sensitive to leg cues and therefore less likely to switch the tail than in the immediate period running up to being in season. And certainly during the majority of the 3-week cycle, any such signs that are attributed to being a mare are likely to reflect something completely different.
When diagnosing a mare that has either behavioral issues or pain issues, can it be helpful to track the cycle so that you can attribute the right things to that cycle?
Absolutely. I think we always have to contextualize behavior. And it is important to say, under what circumstances are we observing that behavior or those behaviors? And is there any pattern to them? Do we see them every day throughout the month? Or do we see them more commonly according to the work that the horse is being asked to do? So I think it's really valuable to keep a record of the horse's performance on a day-to-day basis so that we can see whether or not there are any patterns to the behavior relative either to the estrus cycle or to the work demands being placed on the individual or its interactions with other horses.
That's a good point too. Yeah, it's interesting because that's relates back to what we talked about in our last live when we talked about what ethograms are. And as a behavior specialist, I often suggest to people that they just spend time looking at their horse's behavior for finite amounts of time and writing down what they see and figuring out, what behaviors are normal for that particular horse. So really it's no different, and it's really no different than the ethogram that you built for identifying pain. You just observed the behaviors and wrote them down, right? So it really underlines how useful just observing can be when you look for those kind of patterns.
Absolutely. I think it's also very interesting to observe that some behaviors actually are not apparent during the presence of a person. So if you really want to understand an animal's behavior, sometimes you have to acquire CCTV footage of the individual throughout, for example, the night, because it may only be during that night when the animal is undisturbed that you see the behaviors that may give you the clue to what's going on. So, for example, you could have a mare which has what we call a granulosa cell tumor. That's a tumor of the ovary when the ovary gets very big. and that can cause episodic colic-like symptoms. But those symptoms may not be apparent during the presence of human beings, and they may only be present when the animal is left alone. And I think there's been generally a lack of awareness that some horses' behaviors are only seen when they are on their own. They disguise the behavior sometimes.
Yeah, I can't emphasize that enough, because I've learned so much from, now it's fairly easy to set up a camera in a stall. But even just a camera on a tripod that I let run, until it like a little cheap digital camera that I let run until it runs out of space. And then fast forwarding through that footage, I've learned a lot. I had a horse that was losing weight and caught his neighbors pulling his grain dish under the fence. So, you're right. You never know what's going on when you're not there. And I think that's very true, that that our presence always affects their behavior. And so it is really interesting to see, for a lot of reasons, what they are doing when we are not there. So you brought up the issue with the ovarian tumors. If we, are not judging mares based on some sort of behavior that is typically marish or typical of mares, is there unsoundness or pain issues that mares are prone to that geldings and stallions are not?
Well, granulosa cell tumors are unique to mares, but they're rare. And I think we have to emphasize that. So they could possibly cause some degree of abdominal pain, which may be manifest during ridden performance, but they are unusual. And with respect to mares and other causes of lameness, the only one which really comes to mind is that hind limb stiffness induced by mastitis. So a mare can get mastitis even though she's not a breeding individual.
Oh, interesting.
It's not common. Again, it would be something which is rare, but it could cause a gait abnormality. But we have no evidence with respect to other problems that mares are more susceptible, other than the condition of tying up or exertional rhabdomyolysis. And certainly in the thoroughbred breed, there is fairly strong evidence that mares are more predisposed. Whether or not this is a heritable predisposition or whether it's related to their temperament and excitability is not really well defined, but there's certainly, in all the studies that have been done, it has been demonstrated that mares are more susceptible. But with respect to any other lameness condition, we would rarely see mares dominating.
That's interesting. So when people are talking about certain things that they consider to be typical of mares, there's probably some conformational bias. They think that mares are like this, and then when they see a mare that is like this, they attribute it to being a mare, which I think we tend to project our own worldview on situations. And I think there, of course, there's a long history of attributing undesirable behavior to female hormones in all different ways. And so I think that's part of my journey towards learning to really love training mares, was realizing how much of those assumptions were coming from my bias. And then once I let go of those, I actually found exactly what you were saying, that the tendency of mares to want to show off can actually make them, particularly for my discipline, can make them more brilliant, more exciting to watch, and more enthusiastic about participating, because they really have that desire to be looked at. If and the perfect example I can remember is watching Brentina, who was a dressage world champion many times over, and I remember watching her just in the warm-up, and just it was like she had a light shining out of her compared to the other horses in the warm-up. And if we're going to attribute the bad stuff to them being mares, I think it's only fair to also give them credit for the good qualities that might that might come from being a mare. So
well, I mean, I think we're almost in a paradox that there's been this myth that mares are moody, which is not true. It is just a myth. Whereas there is increasing recognition that in human beings, the menopause can create all sorts of problems for women. And
right.
It's great that that's now being recognized. So
right.
there's a strange paradox.
Yeah, absolutely. I think everything that we learn about female humans, we can take that information and attribute it, because there are uniquely female things that we go through. And every gelding, every stallion has variables as well. So it's not, to generalize and just say it's all about mares is to erase the fact that we have to, dog earthquake, that we have to look at every horse as an individual and not go in with these labels, as Megan was talking about, that sort of close our eyes to what's in front of us. If we assume that a mare is going to be cranky and problematic, we're going to really focus on those negative traits. And
yes, I mean, what we have to identify, what are those traits and what are the potential causes of those traits and under what circumstances do they occur? So we need to contextualize everything.
Absolutely. And I think when I look at the 24 behaviors, I do think there are some on there that I, in generalizing, would say are more common in mares. I would say specifically like the ear pinning, tail swishing, sometimes bucking. And one interesting one is I've found that I notice chewing the bit and moving the mouth a lot more in mares. And when I break that down as, is that because they're a mare? I think that's true of all sensitive horses that are trying to communicate something to me. So I think where I learned to really appreciate mares was that if they are more expressive and they are giving more of these behaviors and they're not related to pain, if we can rule that out, then I can look at it as this mare is showing me what she's thinking and feeling. And that's a bonus. That's an advantage in training, because then I know what she likes, what she doesn't like. I know if she's expressing that she's unhappy, I can change what I'm doing or change the environment in a way that I can see the behavior change. And so it becomes a huge advantage over a shutdown gelding who is just standing in a stall, not expressing anything, and you get on and he doesn't change at all. Doesn't necessarily mean there's nothing going on. And sometimes those are the ones that don't get diagnosed with lameness in time, as we've talked about so much with the ridden horse pain ethogram. If we apply that, we can catch those lamenesses early when they're still treatable, as opposed to waiting until it's, the damage is done. So again, that's an advantage to a quote unquote moody mare, as if she's telling you that something is wrong, you can address it earlier in the game and get something done about it. So you've said that the issues that are specific to mares are pretty much all rare. But if someone is concerned about buying a mare because they're worried about more pain issues, when you do a pre-purchase exam, for instance, are there any things that you look at that you wouldn't need to look at if you were vetting a gelding? Like, would you do a pelvic exam on a pre-purchase?
I have never in my entire career done a rectal examination as part of a pre-purchase examination. I see no reason to do so. I mean, they are used in horses that are being sold for breeding purposes, both male horses and female horses. But I think it would be very, very unusual as part of a pre-purchase examination to do an examination per rectum. And it's not an innocuous procedure either, because there is a risk, albeit a low grade risk, of tearing the rectal wall, which can have catastrophic consequences. So I think you would be ill-advised to be performing that for those behaviours.
Oh, wow.
And is there any pattern see them?
We're getting an echo.
Day,
Megan?
Or do we see them more commonly according to the work?
There we go. I think Megan had her sound on behind the scenes. So that we're going to go ahead and start asking some questions that are being submitted or have been submitted from listeners. And the first one I think is a pretty obvious one, and you've kind of touched on this a little bit, but what about medical interventions? We actually got one question about spaying. If a mare does have behavior that can be attributed to her cycle, if it's coming up on a regular routine basis, spaying seems like an extreme response. But what about all the different medical interventions? There's Regimate and Medroxy and all of the, and from the range would go from probably the depot shot up to spaying. Do you think that those are worthwhile? Are they effective?
I think that's always difficult to say, because I think Regumate, which is a synthetic progesterone, Altronogest, is widely used and is actually permitted under some competition regulations because it is felt that it enables mares to compete on an equal basis. Whether that's right or wrong is open to debate. I think that Regumate and other such drugs get overused. When I ask a client why they had their horse put on Regumate, frequently it will be due to a variety of different behaviors which are in fact not related to the estrous cycle, and they are displayed at any time, not related to when the mare is in season. So then that doesn't seem to me to be a reason to be using Regumate, and it is likely that any effect is a placebo effect on the rider rather than having being of medical benefit to the animal. If, however, there is the unusual horse which is repeatedly in season and showing signs that are undesirable when the mare is in season, then there is some rationale for stopping the mare coming into season, which is the reason for using Regumate or some of these other synthetic progesterone drugs. I think that it would be very extreme to consider surgical intervention, personally.
Yeah, I would think so. That as a sort of tangent to that, that's not quite mare related, I remember about 10, 15 years ago, it became fairly common to administer Regimate to geldings. And at the time, what I was told was that it the estrogen would cause at one point I heard it would cause the tendons to loosen. And then another point I heard that it would cause the tendons to restrict. And then more recently, I've heard that it can be a treatment for upward fixation of the patella. Do you think that in your orthopedic practice, do you consider Regimate to be effective for any of those in any of those ways? And if so, would that maybe be what people are seeing rather than a placebo effect?
No, in my experience, I don't think there's any evidence to suggest that it influences the function of tendons or ligaments. We know that at the time of gestation, the pelvic ligaments become more relaxed, which is often under a hormonal influence. But we don't have any evidence that that is a generalized effect. The same things happened in women, but you don't feel that the ligaments and tendons in your hands are changing, despite the fact that you may be aware of things changing in your pelvic region. So we have no evidence that it is a generalized systemic effect rather than a local effect. So I personally would see no reason to be using Regumate in the management of upward fixation of the patella. I think whenever you see many different treatments being used for a specific condition, it tends to suggest that many of those treatments are unsuccessful and they just go through waves of popularity. And we see this with all sorts of different conditions, with different treatments being tried, then going up in popularity, plateauing, and then going down again because they're probably not very effective.
Yeah, that's a good example of a phenomenon that I see a lot, which is that, as you said, during gestation, the ligaments change. So that little piece of truth that we know to be true can be used to as proof of pseudoscience, which gets spread like wildfire. And there's, it's true in the world, it's true in the horse world, particularly, that we hear by word of mouth that something works, and then we try it to treat behavior or lameness. And then it just gets ingrained in the culture. I know, giving depot shots or using Regimate as a calming agent is something that I've heard vets say many times. And, that could very well be a placebo effect. Or it could maybe, make behavior a little bit more consistent as opposed to up and down. But from what you're saying, I gather that there really is no way that could be accurate. I guess we can look into if anybody has studied that, but it seems like what you're saying is that that those agents are, in a way, almost preventing people from diagnosing the problem.
Yes. I mean, I think if you have a mare and she's displaying all sorts of different behaviors, tail swishing, ears back, being difficult, squealing, bucking, you need to be investigating why.
Mm-hmm.
Because it's unlikely that this is so-called marish behavior.
And if you put them on something and and see some improvement, you might stop looking. And if being a mare means that they're more sensitive, there could be negative effects that could be getting ignored as well. So it sounds like it could mask things, and it could also have a deleterious effect on training potentially.
Well, I think people tend to push horses on Regimate because they suspect that they've got a mare-related problem, without thinking that it may actually be a pain-related problem. So they continue the horse in training, and if there is an underlying problem, that underlying problem is not going to resolve, and it may get worse, and other secondary problems may develop. So you then get into a vicious cycle. So I think it's really, really important that you ask the question, why is the horse exhibiting these behaviors? Especially if those behaviors cannot actually be specifically related to when the horse is in season compared with when it is not.
Right. We've got a couple of questions that are rolling in now. Let me look and see what those are. So I think we've covered this, is how many behaviors should we look for in mares in season, and is there one or more particular behavior to pay attention to? I think we've pretty much covered.
Well, I think just to re-emphasize, the signs that a mare is in season are clitoral winking, maybe raising of the tail head, squatting to urinate small amounts, and being more compliant, leaning in towards other horses, and being more tolerant. Those are the principal things. And ears forward when approached by other horses.
Okay, and then we have a question. Can you provide some insight into how proprioception is compromised when horses experience musculoskeletal injuries?
Well, this is somewhat unrelated to mares.
It is.
But we can tackle it. First of all, I think we need to explain what proprioception is. And proprioception is what happens intuitively without you being aware of it, in that when you place a foot to the ground, messages go from the foot through the peripheral nervous system up to the brain to tell the brain where the foot is, and then you adapt your movement accordingly in a completely automatic way. This sometimes goes wrong when you're walking downstairs and you don't realize there's another step, and suddenly you find yourself realizing that this was an unexpected feeling as you get that extra step. When an animal has a musculoskeletal injury, and that animal could include human beings as well, our central nervous system adapts, and it adapts by altering the movement patterns. So in older human beings, this often results in, because the movement pattern is being altered, because, for example, the person has got chronic hip arthritis, they alter their foot placement, and that makes them more prone to stumble and perhaps to fall over, which makes them predisposed to getting hip fractures. The same basic principle of modification of movement occurs in animals, but we're just less aware of it. And it takes time, when the problem has resolved, for the more normal movement patterns to be restored. And sometimes we have to retrain those movement patterns to restore normal movement patterns.
Fascinating. We may have to do a whole live on just on that subject, I think. And we got this topic of mares from questions in our last live. So it's awesome to find out what people want to know, because we're going to keep doing these almost every Thursday. So for people listening, if there's topics like that you would like to have Dr. Dyson expand on, please let us know. Hi, Megan.
Hi, yeah, we're definitely always looking for what people want to know about, because there are a million questions we could all ask Dr. Dyson. We're about out of time here, so I wanted to wrap things up. And I did want to ask Dr. Dyson, are there any other things that you would like to talk about? Any other thoughts that you'd like to share about things that are specific to mares?
Well, one of the problems that I often see is that if a mare is identified as being lame, the first question that the owner says to me, well, can I breed from her? And I always say, well, let's just think about this. She's only 6 and she's got several different causes of pain causing lameness. We have to think, why has that occurred? Is there some hereditary predisposition to the development of these conditions, which is why she's developed these problems at a relatively young age? So I always think that it's fine to breed from a mare who is lame because she's had a known accident. So, for example, she was kicked and she sustained some horrible injury of the hock, and so she's chronically lame associated with that. There's absolutely no reason why she should not be used for breeding purposes. But if the horse has been retired because of multiple spontaneously occurring lamenesses, then that is probably not a good individual to be selecting for breeding, which is why I think it's important that we recognize that some of these behaviors that we've been discussing today are more likely to reflect underlying musculoskeletal pain rather than being marish behavior. We need to get away from this context of moody mares.
Yeah, that's so important. Thanks so much for sharing that. And thanks for being here today, answering folks' questions. And we're looking forward to our next event, which will be next week. And if there is a topic that you'd like to see us discuss, please be sure to let us know. Be sure to follow us on Facebook as well as on Instagram, so we can let you know when those events are taking place and what topics. And we are regularly asking for questions ahead of time so that we can have those for Dr. Dyson to answer. We do have our free mobile field guide for the ridden horse pain ethogram that's available on our website, the 24horsebehaviors.org, so 24horsebehaviors.org, or on trainwithtrustproject.org. And if you haven't already seen Padma Video's documentary short film featuring Dr. Dyson, called The 24 Behaviors of the Ridden Horse in Pain, Shifting the Paradigm of How We See Lameness. It is free on YouTube, has always been free, and will be free, because the most important thing is getting this information out there. And that is why we're so happy to be able to do these live, so we can really get information out there to bust myths, like these myths about moody mares, and help people and horses work more effectively together and be in greater partnership. So thanks to everyone for joining us.